Hello, this is Congressman Brad Sherman. I'm in our constituent service office located in America's best named city, Sherman Oaks. This is our 8th in a series of San Fernando Valley town halls during the COVID crisis, which is also accompanied by an economic crisis, and now a focus on race relations in our country as well. And while I mention Sherman Oaks because it has the same name as my surname, I am totally dedicated to all of the towns in the South and West San Fernando Valley. This is the 8th town hall, as I mentioned, that we've done during this series, and we will be dealing with the COVID crisis, the economic downturn that has resulted from it, and the fact that the pain of watching George Floyd die has focused our attention on systematic racism in our country. In fact, on the 4th of July, I had a chance to be with the food drive in Valley Village, but also with the Black Lives Matter demonstration at the gallery in Sherman Oaks. And, of course, that demonstration goes on every day at noon, but especially on Saturdays. And I didn't think there was anything more patriotic than protest. I also had a chance to be with a small group in the United States Capitol who introduced the George Floyd Justice and Policing Act, which of course passed the Congress roughly a week and a half ago. And in our last telephone town hall, I went through all the details of what that bill contained. If we get questions on its contents, I'll cover those in the question and answer segment. This is like a large conference call. We have many thousands of people joining us tonight. You can sit back and listen, or you can get in queue and ask a question or make a statement. To get into the queue, you dial *3. My staff will talk with those who dial *3. If you just want to talk to my staff about a particular problem you're having with a federal agency, that's fine, but most people who dial *3 want to ask a question, and we'll put you in the queue. We will have our next town hall probably on August 4th. To get all the details, go to our website, bradsherman.house, that's for House of Representatives.gov, and you can RSVP for our next town hall, which we have tentatively scheduled for August 4th at 7 p.m. Now, I want you to take down a phone number, 877-229-8493. If you get cut off, you can dial back into this telephone conference with that number, but you'll also need to add PIN number 13402. We have two guest speakers here. We'll have Councilman Paul Koretz, who will join us at about 7:30 or so. And much earlier in the program, we'll hear from Dr. Lynn Goldman, who is back by popular demand as a real expert on this COVID crisis. As my opening statement, what I want to do is answer two of the questions that people who RSVP'd for this telephone town hall sent in. And by answering those questions and adding some more material, I want to bring to your attention what I think will happen at the end of July in terms of new legislation. The first question is from Setrag Vakian. I hope I pronounced your name correctly, or at least close. And the question was, and he's from Chatsworth, and the question is, what happened to additional stimulus for us during the pandemic? People are aware of the payments of $1,200 per adult, $500 per child. We provided that in the CARES Act. In May, I joined with my colleagues in the House in voting for the HEROES Act that would cause a second payment to go out. However, Senator McConnell, who runs the U.S. Senate, has been unwilling to take that bill up. However, I think that there will be new legislation negotiated in July that is likely to include another round of $1,200/$500 payments. The second question is from Christian Pellegrini, and Christian asks, is there going to be another round of PPP money for those who already got it? I have been reading something that they called a P4. I'd like to know how close we are, etc. First, the existing PPP deadline has been extended to August 8th. So if you know of a small business or a nonprofit organization that still hasn't applied, they need to get their application in, and we in this office can be of assistance. But many millions have gotten the loan already, and they're spending it on keeping their staff employed, and they wonder whether it's going to be renewed. There is a bill pending, the Prioritized Paycheck Protection Act. A lot of us have co-sponsored it to extend PPP. I think that what is likely to happen is that there will be a second round of PPP for those who have already gotten their loan, which really is a grant if things work out. But there'll probably be some additional restrictions. Particularly, the business will probably have to show that it's had a significant decline in revenue during this COVID crisis. So to preview what I think the Congress will pass, and look, no one knows, it's being negotiated now. There is the unemployment insurance, where we've opened it up to gig workers, independent contractors, and also provided an additional $600 per week. I suspect that will be extended past the end of July, but and will probably cover gig workers, independent contractors, but I think that $600 figure will go down. Many Republican senators are saying in their states $600 a week is a lot more than people can make by going to work, and they want that figure lower. So I think Republicans are trying to sharply curtail the program. Democrats are trying to extend it. I think that will be compromised. The number one Republican objective in this new bill will be limits on lawsuits, to say that if you're at a business premises as a worker, as a customer, if they follow the rules and you catch COVID there, you can't sue them. My guess is the Republicans will be successful in negotiating for that. The number one Democratic objective is probably aid to states, cities, and school districts. And I think both sides will, and that's just critical because revenues are way down. And for us to defund schools at this time, defund city governments at this time is a real mistake, economically and practically. The stimulus payments I've talked about, the PPP I've talked about, and finally I hope that we're successful in fighting for an additional $5 billion for medical research. So far, we've only spent 1/4% of the money we've appropriated to fight the disease. And the vast majority of money has gone to repair the economic damage of the disease. There are a lot of medical researchers who have the skills who are not doing medical research now. That's because all the non-COVID medical research studies have been suspended. Not all of them, but most of them. So that's what I predict will be in the bill. And now I want to introduce a guest speaker who has been with us at least 4, maybe 5 times. She is back by popular demand. Dr. Lynn Goldman is Dean of the Milken Institute School of Public Health. She's a member of the National Academy of Medicine, on the governing board of the National Academy of Sciences, and an advisor to the FDA and the CDC. Dr. Goldman, what can you tell us?
Well, thank you for having me again, and it's a pleasure to be able to talk to your constituents. So I thought, given that you had started with the George Floyd murder, that it might be interesting to talk a little bit about specifically how the pandemic, the coronavirus, has been impacting minority communities. Because when we talk about how Black Lives Matter, well, there are issues certainly around law enforcement, but there are also many issues around health disparities. And this pandemic seems to aim itself right into this wedge where we have these disparities within our population. So what I've been looking at in that regard is, especially the state of California, what kind of disparities do we actually see? And one thing that's quite striking is actually with Latinx populations who comprise about 40% of California, yet they are making up about 55% of all the cases. And that's true actually in every age group, including children, the elderly, that we see this consistent pattern of far more transmission, or at least cases identified among that population here in the state. But then we also see some interesting patterns with the Black community in California, where it isn't so much that there's an increase in the total number of cases until you see the elderly population. For those who are Black in California, who are over the age of 65, they are more likely to have COVID-19 in proportion to their presence in the population. But what is really devastating is that they have an extremely high, what we call in public health, case fatality ratio. And what that means is that if they have the virus, they're far more likely to die from it. And that is quite devastating. And so, for example, if you take those who are over the age of 65, there are about among the whole state, those over 65 up to the age of 79, about 5.5% of them are Black. 7% of cases in that age group are Black, and 11% of deaths in that age group are Black. And so there is this problem of mortality that is probably a reflection of the other health disparities that exist in our population. The fact that there's so much more chronic disease, diabetes, hypertension in that population, that people who are Black, there are probably roots of that in the stresses that have to do with racism, with poverty, with other factors that lead to those chronic diseases. Top that off with COVID-19, and you see a much higher risk of death to those who get that disease.
Doctor, if I can chime in, I've talked to local hospitals here in the San Fernando Valley. I don't think we're at an overwhelmed situation yet, and they're doing a good job. But there are more COVID cases in those hospitals located in the parts of the valley with the highest Hispanic populations. Now, the entire valley is diverse, but in those neighborhoods or towns with the greater percentage of Hispanics, you've got the greater number of hospitalizations.
And I think that there's something going on there that is very important. I think first and foremost that many people who are in frontline jobs that bring them out, among other people, are Hispanic. And that may be people who are bringing us our food and making sure that our streets are clean and are taking care of all these things that we need in order to be able to stay at home. They're not staying at home. And I think that is part of the picture. I also think that there is the possibility of more crowding and housing, that it's harder for people to isolate if they are ill, that they are more likely to be in contact with other family members, so you're going to have more spread within households. So a number of factors, and that are also go back to, again, the Black Lives Matter movement, that there are these enormous disparities, there's differences in our opportunity to have housing where we can spread out and be isolated within our own home.
Let's see. Just to go by the numbers, California's having about 7,000 cases a day, but it varies. Maybe a better way to put that is 5 to 8,000 cases a day, and 50 to 100 deaths a day. In LA County, you're talking about a wide range, because with just one county, there are blips in the statistics, but 1,000 to 4,000 cases a day, 20 to 70 deaths a day. The San Fernando Valley, about 500 cases a day, but that really goes up and down. If you look at today's daily news, the headline is 4,000 plus new cases in LA County, shattering a single-day record, and 48 deaths reported. The 48 is not an all-time record. The 4,000 is, but that's, again, a statistical blip in that there was one lab that accumulated all its results July 2, 3, 4, and 5 and reported them all on the same day, reporting 2,000 of those 4,000 new cases. But that being said, this disease is not going away. A lot of us in March thought, okay, we can change our lives for 3 months, and then the disease, then we win, right? That's fair. And, well, the disease doesn't view it that way. And we're going to be having to change our behavior for many, many months to come. And in fact, the disease is hitting us harder now than it did in March and April. So, Dr. Goldman, what else do we need to know?
Well, back to that, I mean, one thing that I think we're seeing is that, oddly enough, it is older people who seem to be learning and staying at home and being more careful, and it is younger people, especially young adults, that are increasingly comprising the cases that are being reported every day. And so we've seen a real shift in who is showing up with positive COVID-19 tests. It's more and more likely to be younger people. Now, I think we all know that younger people have a great need for contact, for social networking, and that is probably a piece of it. It's probably harder for them to sustain for a long period of time being at home and trying to think of ways that, within society that we can fulfill that need without their being put at risk. There are other things too, though. Some young people have even been holding COVID-19 parties where they've been trying to get the disease. And I think
that is simply immoral, because they may not die from this disease, but every one of them that gets it could be passing it on to somebody who has pre-existing conditions or is over 60 or 70 or 80 years old. I'm going to go to one of our live questions, and then I've got a written question that was turned in by our RSVP participants for Dr. Goldman. Scott, who do we have on the line?
Yes, sir. We have Lynn from Valley Village, who asked the question, once people need to start paying rent, how will people be able to provide them for themselves paycheck to paycheck? Lynn, you're going live for the Congressman to answer your question.
Lynn, I don't have a complete answer for you. The city has prevented evictions, and then the federal government has prevented evictions from any apartment where the federal government, through outfits called Fannie and Freddie, Fannie Mae and Freddie Mac, have provided the financing. And so you have two levels to prevent eviction. There are proposals for the federal government to come in and pay people's rent. Otherwise, it hangs over. And then there are proposals like the $1,200, which sounds like a lot if you're paying rent in Wichita. One problem we have at the federal level is things are so much more expensive in Los Angeles than they are in Tulsa and Oklahoma City and Lincoln, Nebraska. and there's no way to get Congress to pass a law that says Angelinos get $2,400 and somebody in Lincoln, Nebraska gets $1,200. So we do have proposals to pay rent, but at this point, I don't think they pass in July. So it's a matter of somehow either the economic stimulus payments, the PPP program requires employers to keep people on the payroll, or the unemployment insurance to somehow have enough money to eventually pay the rent. Luckily, there's no eviction at the present time. I think we will revisit that issue in. I don't think it'll be part of the July program, and I don't think we're going to pass a bill in August. So if we deal with this at the federal level, it's going to be in September. We have Councilman Paul Koretz on, and when I introduce him, I'll see whether the city has I believe the city is working on a program, but I'm not sure how many renters are going to be covered. Let's take one more question.